Mr. Turner, can you please call the roll?
Sure thing. Miss Allard? Mr. Constant?
Here.
Mr. Dunbar?
Here.
Miss Kennedy?
Here.
Miss LaFrance?
Here.
Mr. Perez Verdia? Mr. Peterson?
Present.
Miss Quin Davidson? Mr. Rivera?
Present.
Mr. Whittleton? And Miss Alto.
Here. Thank you very much, Mr. Turner. So we have 3 items on our agenda for today. We are going to do an initial audience participation in just a moment, but then after that, we have our standing healthy spaces update, shelter and mass care outflow update, and then the facilitation resolution we'll discuss. I had one request to speak at the beginning of the meeting. Mr. Paul Stang, are you on the line?
And Miss Alatel, this is Quin Davidson. I'm here too. Sorry, I missed the roll.
Welcome, Miss Quin Davidson. Mr. Stang, are you online? And I believe if you are on the phone, it's *6 to unmute. Okay. I'm not hearing him. So I think what we'll do is we'll jump in and we'll make sure we have enough time for him to speak, because he did request the opportunity per the instructions on the agenda. So with that, Director Durand, are you with us this morning?
Yes, I'm here, and good morning.
Good morning. Please go ahead.
All right. So my name is Josh Durand. I'm the Director of Parks and Recreation, and I'm here to give an update on our Healthy Spaces division. The division does continue to address loose trash within the acreage bowl. We typically
administration, so I'll have to offer them.
I'm sorry. If you're on, can you please mute if you're not the speaker? All right. Go ahead, Director Durand.
Yeah, thank you. And typically we focus on Midtown, downtown, the Spinard corridor, and areas surrounding the Sullivan Arena within Chester Creek Sports Complex. We have found some new areas to focus on. And those include Arctic Boulevard north of Raspberry, as well as the public right-of-way, which is adjacent to Javier de la Vega Park. We have currently not been posting or abating camps for about 2 weeks now, and this is because we don't have capacity in mass shelter, and it's been about that long of a time frame. We do have camps that we do plan to post and abate in the near future. They are currently located within South Tekishla Park near the Northern Lights Boulevard. We also have areas in Cuddy Family Midtown Park and surrounding the park. We do have a larger camp that has been growing within Valley of the Moon Park, just west of the C Street Gardens in the forested area. We also have a camp that's located near Dowling and Elmore, and then we have a single camp that is along the coastal trail. We are entering into our first winter operation. We have done the seasonal staff change as it relates to that. Our priorities will continue to be established as to where we go next based on public safety surrounding the location of the camp, and public safety associated directly with the campers themselves. It's also worth noting that with a typical 10-day posting camp abatement, when we do go in to start cleaning up the camp, in all scenarios that both the CAP team and park staff, we collaborate and coordinate with the campers to assure that they have all their personal belongings they need. We don't go in aggressively and just take everything. We want to make sure that they take their belongings because 1, we want them to have them, they're theirs. 2, we want them to have them for survival. And then 3, it minimizes the amount of trash that we need to bring to the landfill. And this process of this coordination and collaboration with the campers, I would say on average takes about 3 to 4 days. It's not a quick process, and we try to assist as much as we can. This will absolutely continue through the winter months, and we are positioning staff, and I know that APD is doing this as well, to be more cognizant of it during the winter months because we have colder temperatures. So items for survival become more paramount. Jackets, sleeping bags, tents, heating elements, things of that nature. And we will continue to do our best to make sure that when they do leave, that they do have those belongings with them. And that's the end of my report for this morning.
Thank you, Director Durand. I have put myself in the queue. Members, please put yourself in the queue if you have any questions via the chat, or you may send me a text message. 2 questions. First is, I've had several requests for a written winter camp abatement policy. I think you've described it verbally today, not just from providers and our coalition friends, but also from community councils. So if that is possible to have, since this is the first winter, I think it would be really a helpful document for members so that we have something to refer to and utilize to address questions that will arise. The second question, or actually the first question, the first was a comment, is that when I look at the dashboard with regard to total mass shelter, I see that the Sullivan Arena is over its initial capacity. It's up to 420, but I do see units available in non-congregate locations. Can you address, if you know, how the non-congregate location availability plays into the ability to abate camps?
Yeah, yes, thank you for that question, Chair. I might not be the best person to answer this, but I'll do my best. Essentially, the mass shelter doesn't have the same barriers and constraints that other shelters may have. And we want to assure that if we're baiting a camp, that some of those constraints don't prevent them to finding a place to sleep. So our approach, we look at the capacity within mass shelters, so it's an all-inclusive availability for the campers so that they don't find themselves getting turned away. And then the points you made about the written, we do have information on that. There really is no change as we move into the winter months, but it is our first time doing this. And we do see this as an adaptive approach where we will be generating a policy and approach through the experience of our efforts this winter. So we will take steps to provide a written document as it relates to our policy and protocol, but I do see as an evolving document as we make our way through the winter.
Great, thank you. I appreciate that. We've been joined by Mr. Weddleton at 11:07. Are there any other questions with regard to the Healthy Spaces update before we move along in our agenda? Okay, thank you, Director Durand, for joining us once again. We're going to go ahead and move on. Next, we are going to hear from the coalition about the outflow work and the housing surge. And if we need to share those slides, which you can also find on the committee's website, please let us know, and I will turn the floor over.
Thank you, Chair. This is Jasmine Boyle of the Anchorage Coalition to End Homelessness, and I am hoping you can all see my slides. This will be the same update that we will continue to provide monthly with updated data on the Housing Surge Initiative. And so the first couple of slides I will not spend a lot of time on because it's simply a repeat just to center everyone in this conversation. So again, to make sure everyone is aware, about 2.5 months ago, we started the work of a housing surge. It is very focused on single adult homelessness. So in our world, that is people over the age of 25 who do not have children in their custody at this time. The reason for that focus is to stand down mass care and to support the work of helping individuals in the Sullivan and individuals in our non-congregate hotel locations to access housing resources that are made available through ARPA and COVID CARES Act funds. Again, very intentionally focused on those experiencing homelessness in a new or different way as a result of COVID. So this information does not change month to month. It's just a reminder of the scope of this project. Again, the slide in front of you currently with this table was provided, information provided to us from Mass Care 2 months ago or so around as Mass Care and the city was contracting with different providers for different pieces of this work. What Mass Care was estimating would be the outflow produced by different initiatives that were funded. And so I, again, just keep that slide in here to remind you all of what we were anticipating to see as these contracts were finalized, staff were hired, and these projects were implemented. Again, to remind you all, we are meeting weekly with a large multidisciplinary team to focus on this housing surge and continue to bring in not only infrastructure partners at the local and state level, but also to focus on the providers that were funded to do work that matches with the intent of the housing surge. In the month of September, because we will always provide you a report of the month prior, I'm happy to say, and I'll share the data in a moment, that we have seen an increase in the number of clients being served through the housing surge. The providers on all sides did need some time to finalize contracts with the city to hire and train staff. And so now that those activities are ramping up, we are starting to see more movement, and I'll share those numbers with you specifically in a few minutes. Additionally, I mentioned last month that a piece of what we have all acknowledged for many years, but we are seeing more clearly in the time of COVID, is that there are a number of individuals in our shelter system who should not be in our shelter system because they have unique needs that will not currently be met by the shelter system. And so very explicitly, we're talking about individuals with sophisticated physical or behavioral health needs, oftentimes individuals that are sent here from other shelters statewide or have been evicted from assisted living homes, but individuals who need additional care. So in partnership with the Anchorage Health Department, we have been working with the providers in the shelters and our case management organizations to help individuals that are flagged as potentially needing additional services to go through the person-centered interview process with the Aging and Disability Resource Center in the Anchorage Health Department. Lots of acronyms, but the short version of that is trying to help individuals get unique needs met when we know that those needs will not be met in the current shelter system, nor were they intended to be met in a mass care shelter. So that work has again started ramping up, and we believe that is going to be a very positive impact on our individuals with more sophisticated needs, though it continues to happen at a micro level and is a very time-intensive process. So that's not a thing that we anticipate to move quickly, but it is moving. And of course, as many of you know, the emergency housing vouchers came into the state of Alaska. We have been very gratefully working with the Alaska Housing Finance Corporation. And last month, the first batch of those vouchers came available to individuals in Anchorage. There are already over 20 referrals already out with individual clients who are working with case management services to identify units that meet their needs and hopefully move into a sustainable housing future. So that work, again, continues to ramp up in a positive way. I think many of you have heard that there were a lot of complications around data with the work with mass care as we continued to shuffle our shelter system around over the last year and a half. A concern that arose out of mass care was some data confusion around a few of the hotels and Sullivan Arena. I'm happy to report that Beans Cafe engaged in an around-the-clock effort for the last several weeks to clean up the last of their data. And we're now picking up that work for our federal reporting and other things that are important to continuing to access HUD funding for people experiencing homelessness in Anchorage. So that work is also moving in the right direction, and I'm grateful to the Beans Cafe staff for following up with those efforts after they transitioned out of the Sullivan Arena. And then finally, still very pleased in the month of September, the continued partnership around testing, vaccinating, educating, and also treating other health concerns for our individuals experiencing homelessness. But primarily, we're very pleased last month with the work around COVID and making sure that our vulnerable clients are as protected and educated as possible around the pandemic due to their unique healthcare needs. That to say, in terms of data, again, you're going to see the numbers ramping up, and my ongoing reminder for folks that most of these data points are focused on the housing surge and not necessarily the system as a whole. The exception to that is that top line. Again, the city of Anchorage finally met national standards for year-round data in November of 2020. We continue to use that data to track the number of single adults who are coming to the system for help. And that in the month of September was over 2,000 unique adults. I know there's a lot of conversation about shelter demand right now, and so it's always important to point out this does not mean all of those individuals need shelter. Some of those individuals are moving directly into transitional housing or other types of programs, but that is the number of people over the age of 25 who interacted with the system formally to say we are experiencing homelessness and we need some type of resources. If we drill into that, 209 unique individuals were directly engaged in the month of September through case management or other services to begin the process of getting them out of mass care into housing. And as you can see, 17 of those individuals did actually secure housing and move out of mass care into housing. Again, this is just focused on the efforts of the housing surge. There were actually many more people that found their way into sustainable housing, but we're only talking about this specific effort in this conversation. And then, of course, you'll notice that the average length of time from the moment we began these case management services to the moment that someone moved into a new home did lengthen to about 63 days. I do expect that number will continue to lengthen simply because month 1 and month 2, we were focused on the individuals that could quickly move into housing. And so in some ways, the focus was on people with less complex needs. And so we will continue to see those individuals move more rapidly. But as case management partners get into the work of our more complex cases, I do expect that the length of time will have to settle at a more appropriate average. The length of time to move individuals in our other services into housing is generally upward of about 75 days. So we're probably going to see that number going up just a bit. And then, of course, the other important part of our reporting is to share our commitment with this work was to share with the administration, the assembly, and the health department barriers that we were identifying. Some of the barriers that I spoke about last month continue. I think that the new item that has arose is we no longer have mass care or the Anchorage Health Department represented in the weekly housing surge meetings. It sounds like in talking to a number of the staff who were working with us directly on this project, that through the change in leadership at the Anchorage Health Department, some meetings have moved around, and there appears to be just a transition. So I do want to call out that without having representatives from mass care or representatives from the health department who have been close partners in this work, the housing surge will not move as rapidly as we want. Very specifically, if we don't have partners in mass care talking to us about what mass care is doing inside Sullivan and the hotels, it is virtually impossible for us to connect to those clients to be able to help them access the housing vouchers, the case management, the other resources that we're talking about with the housing surge. So a new development that we will need to problem solve is making sure that the right partners are represented in the housing surge work on the city side. Again, I suspect or have been told that that is partially due to transition. So I'm hoping that next month we will be able to report to you that that has been corrected. In addition to that, there are some other things that we did talk about last month that continue to move forward. One piece of that is partnering with the state of Alaska. I believe that we spoke briefly about it in the last 2 months, that there is a statewide interest in helping to partner with the work at Sullivan. Dr. Morris and John Lee from Senior and Disability Services have been engaged. I believe the health department is now actively involved. But the intent is to take what we're doing at a micro level with ADRC and to elevate that to systemically looking at everyone in mass care that may have higher level needs, be it an assisted living home or someone that requires a personal care attendant for unique physical or medical needs, but to really make sure that everyone in mass care that needs those additional services has been screened and connected with state benefits that could help them access to those services. That's a pretty big lift in the time of a pandemic, as many of those healthcare partners are, of course, focused on the current crisis. But I am pleased to say that I think the Anchorage Health Department helped elevate that over the last couple of weeks, and it does sound like there will be subsequent partnership to move that work forward. And then, of course, I'll sort of sum it up with the other big challenge that continues to arise is access to apartment units. I know that there's been some questions about rental unit accessibility, and I think to hopefully help problem solve some of the confusion, there's often two data points that people talk about in regards to affordable housing units. The first is vacancy rates. And the second is sort of drilling down into those vacancy rates to determine what are vacancy rates for units available to our clients. For example, we are being told by our landlord partners, particularly our large scale landlord partners that have a portfolio that includes more affordable units, that their vacancy rates are hovering around 2 to 3%. And our landlord partners tell me that healthy vacancy rates in a community tend to be between 8 and 10%. Those low vacancy rates make it very difficult for people experiencing homelessness, people that may have economic challenges in their history or rental inconsistencies in their history, or people that have vouchers to find a landlord that will work with them. I know that many people will pop into Craigslist or other online tools and look and see numerous apartments available. So I did want to demystify a bit that when it comes to folks experiencing homelessness and the vouchers and other resources we have available, one, there's a cap at the rental rates. And so many of the apartments that are available in Anchorage are simply too expensive to qualify for our vouchers and or to meet the economic needs of many of the individuals that are employed in the Sullivan. They simply cannot afford high-end units. So it's always important when we're looking at vacancy rates to drill down to vacancy rates for units that are affordable to our clients in the Sullivan and non-congregate shelters, but also to understand if those landlords would even accept a voucher or even accept one of our clients. There are frequently steps in the application process for units that screen out our clients. And so I just want to caution everyone that when we're talking about rental units, really partnering with the individuals that do this work, we certainly have folks like NeighborWorks, Rural Cap, Cook Inlet Housing Authority, Widener Properties, who do partner in renting to clients experiencing homelessness. It's a bit more complicated than just there are apartment units available. That being said, the municipality did contract with our partners at United Way to focus on a landlord liaison initiative with the intent of helping to shore up that landlord work, not only for the short term in this moment with COVID, But I think something we have long wanted was an ongoing relationship with landlords through normal times that would be willing to work with the individuals we are helping to move to sustainability. United Way, I believe, has finally gotten through the contract process with the city and is now hiring staff and finalizing their internal work to ramp that up. So I hope that in the coming month, we will have better news to report as those things are finalized and able to move forward. But I've also included some notes from my team who have been working with landlords in the community and working with the individuals in mass care, that in addition to the affordability of units, there's also complications around things like units that will allow quick leasing, units that will allow, again, individuals from mass care to come on board in their portfolio. And then, of course, we have a number of individuals with pets. And I think we all understand at a personal level that often companion animals can be a saving grace in times of crisis. So the other thing that we're running into at a client level is finding units that will work with individuals that have pets with them. So the last thing that I did want to share with you all is simply the outreach information for the individuals that are experiencing unsheltered homelessness. 59 unique clients were contacted through outreach services in September. A number of those individuals opted into coordinated entry to determine if we could find them housing. The one thing that we are seeing is a reduction in the vaccines. Outreach was partnering with Visit Healthcare to help facilitate vaccines being available to individuals who are living unsheltered. There seems to be some scheduling challenges, and that decreased in September. And so the coalition team and the outreach partners that we work with, they're working on problem solving that. But I did want to call out that you will note a reduction in the vaccines available. We are, again, working to problem solve that and to make sure that testing is available for our unsheltered community members. So with that being said, the final thing I did want to share with you all is the coalition has a full-time resource that will be moving into this work starting November 1st. She's been with us part-time for a couple of months in the background, but I did want to take a moment to say in the future, you'll actually be hearing directly from Taria Ware, who is leading this housing surge work on behalf of the coalition. And she, of course, is on the line today to answer questions, but you may hear a second voice join the conversation this month, or excuse me, in the month of November, and I wanted to let folks know. With that, I'm done with my presentation and I'm happy to answer questions.
Thank you so much. Note for the record, we are joined by Ms. Allard at 11:25. I do have a question, and again, I'll invite members to put themselves in the queue via the chat or a text message. So my question is, in what ways or what are the asks of how the municipality can support the housing surge? As you know, we've been engaged in talking about an exit strategy from mass care, and it seems that one of the most effective ways is to house people. And so what ways can the municipality better support the housing surge?
Thank you, Assemblymember Zalatel. I think part of it is representation. Again, the housing surge was intended to be a quick, focused effort on moving individuals out of mass care through the new resources identified with ARPA and CARES Act funds. So we simply collected everyone that received funds from the city to do single adult homelessness work, which are the individuals living in mass care, and have just been trying to organize that. But first, we need representation. I think it's very, very critical that we have somebody representing, again, the health department and mass care in those conversations. The providers are showing up, but we can't coordinate services without having partnership with the individuals managing the contracts, but also the individuals that have insight into how people are moving through non-congregate, how people are being served at the Sullivan. There's just a lot of changes with the vendor moving over from Beans to 99+1, and now the transition of mass care. out of development services and into the health department. Each of these very significant transitions creates bottlenecks with communication and information that we need to make this a valuable effort for the city of Anchorage, not just with the housing surge, but with all of those services that have been funded. We want to make sure that our community is getting value for this effort and that our clients are getting the best services as quickly as possible. So I think that coordination is really important. I think the other piece to that, again, is just having a sense of predictability or understanding about what's happening with mass care. I'm getting a lot of phone calls at the coalition continuing to elevate that there is not a multi-month plan for our family overflow, and that there is not a plan for funding mass care after the month of October. And I share that because that has significant impacts on our providers who are not sure if they will be contracted to support or continue work in 10 days, 11 days. But it's also really traumatic for our individuals experiencing homelessness, because there are many people in the Sullivan Arena who were told that come September 15th, the Sullivan Arena would be closed. And now the information that they have is that Sullivan Arena will stay open until the end of the month. Not having consistency, not only for the clients, but also for the neighborhood, creates a lot of confusion in our space. And so I think any forward communication about the plans for mass care will help all of us recalibrate and be able to be flexible and appropriate partners.
Thank you. I appreciate that feedback, so we can follow up. Are there any other questions for the coalition with regard to the outflow update? I do want to say I'm happy to see those numbers going up and appreciate the challenges. Ms. Kennedy, please go ahead.
Thank you, Madam Chair. I just wanted clarification. At the end of the report, you, Jasmine, you were talking about vaccines and the low number of vaccines. I'm assuming you're actually referring to vaccinated people and not actually the medication itself. So I'm just curious as to whether that was really just meant to talk about the fewer number of people who are asking and taking the vaccination, not necessarily that the vaccine itself is not available. So can you just clarify? Thanks.
Absolutely. Thank you for the question, Assemblymember Kennedy. I would hate to bungle that in the way I speak about it. I was specifically talking about our partnership to make vaccines available to unsheltered individuals in camps. I believe there is a lot of coordination to make sure that vaccines are available in the Sullivan and in our hotel locations. But we had a subsection of an effort with Visit Healthcare where we were working on coordinating someone that could provide the vaccine with our outreach workers when they went out to camps to try to encourage as much safety as possible for our unsheltered individuals. And so this was not about medication availability. It's simply the coordination of that vaccine distribution in unsheltered locations seemed to hit some scheduling barriers in September. And so we're working on other pathways to make sure that's available for people living outside.
Okay, thank you. That does help clarify. Thank you. Thank you, Madam Chair.
Great. Thank you, Ms. Kennedy. Thank you, Jasmine, and to the coalition. And we will talk to you all again next month. Appreciate the work and the updates you're providing. So the next item is with regard to the facilitation resolution. We set this time aside in the committee. The resolution was introduced at the last regular assembly meeting and it is set for public hearing on the 27th. We wanted to provide this opportunity for members if they wanted to have a conversation about the resolution, any concerns or questions to the sponsors. We can pull that up on the screen. It's also available through the committee's website. It's there under the items of interest from the facilitation. Go ahead and Mr. Turner, can you pull up the resolution? And just as a quick recap, This resolution comes out of the facilitation. It's sponsored by myself, and Assembly Member Constant and Weddleton, and the mayor's office, and it sets forward an exit strategy with regard to ending mass care. And it sets forward the steps that were taken through the facilitation and then ultimately the recommendation from a broad policy perspective. I believe Mr. Weddleton is on. And if Mr. Constant is on, I would invite them if there's anything they would like to share about the resolution, and then open the floor up to any conversation we may want to have about the resolution. Mr. Constant, Mr. Weddleton.
Weddleton here. I have nothing really to add to that, but be interested in anyone's comments. Thanks.
Okay.
So, and for my part, I just want to offer that the work product of the facilitated working group has been good. It's starting to generate community support, and there are still lots of other concerns that we have to hammer out in detail. Very much top of mind for me is what I just heard Jasmine talking about, this message that's out there that in 10 days mass care is gone, which is not true. And it's kind of separate from the resolution, but it's tied together intimately. And so I want folks to know that we'll be digging into some kind of sidebar elements of this, because we need to communicate more effectively to the public that mass care will continue until we have these alternatives in place.
Great. With that, I open the floor. Any members who have concerns or questions or want to discuss the resolution, now would be a good opportunity so that as sponsors, we can take that information back as we move to the date for public hearing. Also, I'll take this opportunity to remind everyone that the facilitation group will be holding town hall tonight, and it will be live streamed, and all that information is up on the committee's webpage so we can continue to get community feedback. Ms. Kennedy, please.
Thank you, Madam Chair, and thank you for the reminder about the town hall tonight. But, you know, it sounds to me like we really can't get any more information than really where we're at the moment and what is currently drawn out in the resolution. I mean, because there are certainly people that want to know more about the private-public partnership financing plan, and we just don't have any details. Is that correct? So I guess, you know, I'm still kind of wondering, even though we have a lot of questions, it doesn't seem like even if we ask the questions, we are able to answer any of them at this point.
Thank you, Ms. Kennedy. I appreciate the question. I think the questions about the financing plan are really as to the implementation. But first, we wanted to get alignment on the broad policy consideration that we outlined on the second page, excuse me, of the resolution to make sure there was full alignment. While there is alignment between the legislative drafting group and the mayor's office, obviously we need alignment with the full assembly. And so that's why we haven't moved forward with regards to specifics around financing and around the implementation. It is work we're doing in the facilitation, but we don't want to, as they say, put the cart before the horse, and want to first get this alignment.
All right, thank you. Thank you, Madam Chair.
Ms. Zalatel, if I might.
Of course.
Thank you. You know, one note, Ms. Kennedy, on the idea of funding plan, finance plan, public-private partnership, in particular, the private partners that are at the table. We're never going to have them within the context of our appropriation plan. They're always going to be taking on the projects within the plan that are theirs. And so I want folks to continuously keep in mind that it's in some ways an ongoing process to keep them committed with us, because they own their funds and they own their prerogatives.
Thank you, Mr. Constant. Ms. Quin Davidson, please.
Thanks, Ms. Salatel. I was just wondering, in reference to what Mr. Constant said earlier and the concern that Ms. Boyle brought up, if the administration plans to bring a request for funding for, beyond October 31st for the Sullivan. And if either members that are part of the facilitated process are aware of that, or if there's someone from the administration that wants to speak to it.
Thank you, Ms. Quinn Davidson. Is Dr. Morris on with us as the Housing and Homelessness Coordinator for the municipality? Okay, well, I'll speak just broadly to it, that it's been raised as an issue, and we've asked for an item to be brought forward. I asked, sorry, not we, I'll speak for myself. I asked for an item to be brought forward that is done in our typical appropriation fashion. So I think at this point, since nothing was introduced at the last meeting, we're looking at likely an emergency ordinance. I haven't seen it yet, but I am hopeful that it's being addressed, and it can also help address the concerns that were raised earlier by the coalition about the stability of those services and the family overflow. So I would say everyone keep their eyes open, and if I get a further update, I will be happy to forward it to the clerk's office to share with all members.
Excellent. Thank you, Ms. Alatel. And I guess I would just say, the longer, I think we've had some conversations between the administration and members in the past over, whether we should fund FEMA reimbursable things so they don't cost the city any money for 1 month or 2 months, or what that period is. And I think we're hearing from our partners that the longer we can fund things and give assurance to those who are operating in these spaces, the better. So if anyone from the administration is listening, I hope that they'll take that course. Thank you.
Thank you, Ms. Quinn Davidson. Are there any other questions or concerns with regard to the facilitation resolution that either the sponsors here that have been involved in facilitation can answer? Otherwise, I will also let you know, we did present to the Anchorage Coalition to End Homelessness, both its advisory council as well as its board, and received an endorsement that was forwarded to all members. We will be continuing to present to community councils, and if any members would like our assistance in talking through this with their community councils, please reach out. We have the town hall this evening, and we'll be meeting with the Homelessness Leadership Council this week as well. So we are trying to reach as many individuals in the public. And then Mr. Weddleton and Dr. Morris met with HRAC, the Houseless Resource Advisory Council, already this month as well. So a lot of outreach here so that we can get considerable public input. And then just a reminder that this is set for public hearing, which isn't the typical route for a resolution, but it is set for public hearing on the 27th.
Meg Weddleton here. Just correction, I was not able to meet with them, with HRAC.
Okay, well, I will make sure that outreach happens if it didn't already. I'll confirm with Dr. Morris and then close that loop because it's really important.
Dr. Morris did.
Okay, anything else on this? Otherwise, we're going to go ahead and move on. All right, well, great. Thank you, everyone, for that. So what we're going to do now is we have legislative and budget priorities, but as we're in the 2022 budget season already, unless anyone has something in particular they would like to raise, we'll keep that short and then move on to audience participation. Are there any legislative or budget priorities anyone would like to raise? Okay, there's one I want to put on everyone's radar. We've had a request to supplement outreach services to cover full 18 months. So hopefully we'll be able to move that through quickly with some of the unencumbered funds that had previously been budgeted for shelter that weren't spent. So just that's a bit of a heads up, and then we will hopefully be able to put that appropriation in and then be able to discuss it at next month's committee meeting as to what those services do. With that, then I'm going to turn back to Mr. Paul Stang, if he is with us, and his request to speak. Are you with us, Paul? And I believe it's *6 to unmute. Okay, well, I'm not seeing or hearing him in this moment. Is there anyone else who'd like to speak?
This is Rachel.
Okay, yeah, you may go ahead. You have a
Hello.
Hello. Please state your name. You have 3 minutes. You may begin when you're ready.
Hi, my name is Rachel Colvard. Thank you, Chris, for getting me the information so I could listen in on this meeting. I had questions. So, like on Tuesday, at the regular meeting, you talked about how we were possibly, or the finance person talked about how we were possibly, potentially 50 to 60 million in the hole due to reimbursement. And then one of the medical officers stated that, you know, in order to get that money to do that coin run, we have to be in compliance. And I'm hoping to hear maybe how we are in compliance or how we plan to be in compliance to make sure that we don't end up transferring that 50 to 60, potentially $100 million of debt onto the taxpayer. Thank you.
Thank you, and thank you for that question. I will pass that on, but I don't know that we have anyone here able to answer that at this time. Is there anyone else who'd like to participate? Anyone at all? Okay, with that, I will let people get some. Oh, sorry, go ahead.
This is Mark Butler.
Hi, Mark, you may go ahead.
Thanks. I'm just speaking as the manager of the Community Council Center, not in any other context, please. So we're very excited at the Community Council's system. Obviously, there was a letter to the editor yesterday by a number of Community Council presidents, which is great input into the system. We're disappointed that instead of hearing about this meeting or hearing about this information tonight at our FCC meeting, that instead this the hearing will the public open house will be at the same time. So we're just very interested in continuing to work with the administration and the assembly on public input. The devil's in the details, it seems to me, on this big project. There was a lot of input by a variety of community councils through our system when there was proposals last year and the beginning of this year, previous to the work, the good work that's been going on here. So we're hopeful that if this is a broad policy perspective, as you mentioned, Assemblywoman Zalatel, that the specifics about siting and different at different locations around the city will be taken through the community council system, and we'll certainly advocate to our council presidents that they do it in a timely manner to assist this process in continuing as fast as it can, of course, and efficiently as it can. Thank you.
Thank you, Mr. Butler. Ms. Quin Davidson.
Thank you, Madam Chair. I know we don't typically answer questions of the public, but I thought that the prior speaker raised an important point that I wanted to make sure we cleared up in this meeting in case there's any confusion. So what we're doing with the funding for homelessness or other services that are related to the pandemic is that we are using our savings that we've set aside for situations like this and then getting reimbursed by FEMA from the federal government afterward for those expenses. So you might have heard Mr. Frisk and others at a meeting talking about how much we are owed by the federal government. I think there are some different ideas about what those numbers are and how it all works together. But the bottom line is this is not money that the taxpayers are going to have to pay. This is money that we are using from our savings that we will reimburse to our savings after we get paid back from the federal government. It's something that cities across the country are doing right now, and this is a normal and typical process. It's just taking a little longer to get reimbursement because normally, you know, the whole country isn't in a disaster setting. Normally it's maybe just a hurricane or something more localized. So that's the reason the reimbursement is taking longer, but it is not something the taxpayers are going to have to pay for. It's just we're going to get paid back from the federal government. Thank you.
Great. Thanks, Ms. Quinn Davidson. All right. Is there anyone else who would like to participate? Oh, Ms. Oh, I'm sorry.
Chair,
Go ahead.
Chairman Zalatel, this is Paul Stang. I had trouble connecting.
Great. Please go ahead.
Okay. I'm Paul Stang, President of the University Area Community Council. Thank you for the opportunity to comment on the findings of the facilitated collaborative process on homelessness. We believe it's a good start. We are pleased that some community requests for services and progression to independent living are included in the plan. We now have lots of information on large facilities, but need comparable data on smaller ones, from 100 to 175 beds. Fortunately, Muni Procurement issued a request for information for homeless facilities that include that size. Richard Marbut stated that a 450-bed homeless facility is the economic sweet spot. That may be true, but it's not the best number for function and effective care. Anchorage's top homelessness experts clearly say smaller facilities are better for all. Many of Anchorage community councils agree. Smaller is more conducive to public-private partnerships and would preclude disproportional impacts on neighborhoods and parks. Smaller is preferable to the noise and safety issues of a large facility. And a good example, of course, is the Sullivan Arena that is temporarily being used. And smaller is consistent with your client community approach. Smaller facilities could house the an EMT and provide navigation services for diverse populations. Please continue to follow the recommendation of the Muni's 2018 report, Anchored Home, Strategic Action Plan to Solve Homelessness. And fully fund the mobile crisis team and keep it in the fire department so trips are covered by Medicaid. Let's be upfront that the proposed facility at Tudor and Elmore, with 200 beds for single adults and 140 for winter surge, is essentially the same as the initial 400-bed proposal, because the so-called winter surge lasts most of the year. We already have the 100-bed Gospel Rescue Mission on Tudor Road. Your initial draft says facilities would be distributed around the community, in quotes, not a 5-minute walk from one another. Thank you.
Thank you, Mr. Stang. I'm glad we were able to get you on.
Good.
Ms. Kennedy, you'd put yourself in the queue right before we heard from Mr. Stang. If you'd like to go ahead.
Thank you, Madam Chair. I just wanted to put another nuance, I guess, on the conversation about the FEMA reimbursable funding. There is some question right now between FEMA and the municipality in terms of what can be reimbursed. So I know FEMA is more purposefully scrutinizing how FEMA dollars have been spent and how they are being requested to be reimbursed. So we're going to have more of that conversation in the Budget and Finance Committee meeting tomorrow. So because there is some contradictions there and some potential different information, I might say, I would just encourage people to listen in on that committee meeting tomorrow at 12:10. Because there are some concerns there that will be raised, and we will hopefully get some answers from the municipality tomorrow and see exactly at what point we might be on the hook for some funding that's been spent that will not be reimbursed. So I would just encourage the public to stay tuned on that question. Thank you, Madam Chair.
Thank you, Ms. Kennedy. Mr. Constant.
Yeah, thanks. And as our experience in 2019 and 2020 taught us, we also will likely have a responsibility to send a delegation back to DC to really fight in partnership with our delegation to get FEMA to honor its commitments, because FEMA defaults to not paying as often as it can. And so despite any kind of messaging we might get that, oh, this or that isn't going to be covered, past experience teaches us that we actually have to go to DC and hammer out the final details to get the full reimbursement. So any message we get concurrently, we also have a second strategy we have to be preparing for.
Thank you, Mr. Constant. Would anyone else like to participate? I did want to mention as well that with regard to the town hall tonight, there is a live stream option. It is on the committee's website. You can find that link there. Not seeing anyone else. Just before closing this meeting, I would say that with regard to mass care, we have an obligation to care for those that we are currently providing shelter to. It's about 750 individuals. And while I understand there could be some concerns having consistency for those individuals.
Hello, Meg. Hey.
Is just a minute, Miss. Yes, I can hear you. Just 1 minute. Oh, fine. Please go ahead. 3 minutes. Go ahead, Mr. Oliva. Mr. Oliva?
Oh.
Were you going to go ahead?
Hello. Yes, I am. Can you hear me?
Yes, we can hear you. Please go ahead.
Okay, well, I want to, for the record, note that my property was not purchased. And even though the press release did a lot of hoopla that, oh, it was a real big part of the homeless plan, it didn't materialize. And partially it involved trying to get a location to move some of my property and then funding. And the study that was done, $50,000 study to purchase my property, that got pushed to the side. So I don't know what's going on with 7 other properties, but I was shorted almost $250,000 on one of my purchases. And I need that money to continue to be in business and prepare my land if they're still interested in buying it. And now Robin Ward has left. Some of that is very confusing to me, but also economically harmful. So I want, for the record, to find some funding to give me the balance of the money that was promised me by purchasing my lot. And I'm not going to let that go. And Chris Constant acknowledged it at the assembly. So when you get your funding, it's $250,000. A lot of money to keep me afloat. That's important. So that's a number 1 priority. The number 2 priority is the respite adjacent to my heavy industrial lot is elder abuse, reckless endangerment of people who are elders and handicapped, putting them on a hill, on a truck route in a heavy industrial area without crosswalks. Violates the Federal Disabilities Act, also just plain humanity as far as treating the homeless. So I want that to go on the record. And thirdly, I don't appreciate Beans Cafe extending their contract at the Sullivan, getting all that money, and when the contract was up, pull the showers, the carts, the cots, the restrooms. That was disgraceful. And they pulled the COVID testing along with the Norcon applicants who were trained to give doses to people who had to be resuscitated. This was reckless endangerment, and it should be investigated. And no one, like Lisa Sauter, who appeared before your committee assembly and said they're sending out mentors to coach people to go into the camps to gain those campers respect and trust, when she doesn't even have the respect and trust of the adjacent property owner.
Time, Mr. Leva.
That's
Thank
totally.
you. That's your time.
Do you
Thank
have
you.
any questions? Do you have any questions?
No, there are no questions in the queue. Thank you. So with that, I would like to say that comments from the public, if they could please not address other individuals of the public and be kept from now on to members of the body or me as the chair, that would be much appreciated. And that'll be a rule we will more forcefully enforce next month, especially as other individuals may not be on the line. With that, we will be adjourned. Thank you.